Hi, my name is Chris Wintroad. I work for the New Mexico Aging and Long-Term Services Department in the State Health Insurance Program. And I'm here today to talk to you about how your Medicare costs can change each year and what's new for Medicare in 2023. Medicare Part A covers inpatient hospital services, skilled nursing facility services, home health care, and hospice. Most people do not owe a premium for Part A, but if neither you nor your spouse have 10 years of Social Security work credits, you may owe a monthly premium. If you're admitted to the hospital as an inpatient, you will owe a deductible of $1,600 at the beginning of your stay. If you have multiple hospitalizations, you may owe the deductible more than once. If you meet your deductible, your first 60 days in the hospital and your first 20 days in a skilled nursing facility cost $0 per day. After that, you owe an out-of-pocket cost for each day of your continued stay. If you have a Medicare supplement, it may cover your Part A deductible. If you have a Medicare Advantage plan, it will have set co-pays for your stay. Medicare Part B covers outpatient costs, such as doctor visits and lab tests. In 2023, this standard Part B premium is $164.90, which is a decrease from the 2022 premium. If your income is above $97,000 as a single person or $194,000 as a married couple, you may pay a higher premium. Keep in mind that if you have a Medicare Advantage plan, you may also pay an additional monthly premium for being enrolled in that plan. If you have Original Medicare, you will owe a Part B deductible of $226 in 2023. You will continue to owe a 20% coinsurance for most services covered by Part B. Thanks to the Inflation Reduction Act, you will pay no more than $35 for each Part B covered insulin product starting in July of 2023. Insulin products that may be covered by Part B include a pump and the insulin that's used with the pump. Part D covers outpatient prescription drugs. In 2023, the national average premium for a Part D prescription drug plan is around $30 per month. Your premium and drug costs vary based on your plan and your prescription drug needs. If your Part D plan has an annual deductible, it can be no higher than $505 in 2023. Thanks to the Inflation Reduction Act, all Part D covered vaccines, including the shingles vaccine, will be $0. Additionally, copays for each Part D covered insulin product will be limited to $35. Insulin products that may be covered by Part D include insulin that's not used with a pump, along with medical supplies used to inject insulin, like syringes, gauzes, and alcohol swabs. If you have a Medicare Advantage plan, the amount you owe varies by plan. Contact your plan for more information about your Medicare costs. If your income is limited, you may qualify for help with your Medicare costs. Contact your New Mexico State Health Insurance Assistance Program, or SHIP, at 1-800-432-2080 to see if you're eligible. There are also changes to the enrollment periods for Medicare in 2023. The initial enrollment period, also called the IEP, is the 7-month period, including the 3 months before, the month of, and the 3 months following your 65th birthday. In the past, if you enrolled later in your IEP, you would have to wait longer for your Medicare to start. Beginning in 2023, though, your Medicare will start the month after you enroll. However, it cannot start earlier than the first day of your 65th birthday month. This change gets rid of or shortens the gap in coverage for those who enroll later during their initial enrollment period. The general enrollment period, also called the GEP, runs from January 1st through March 31st of each year. In the past, if you enrolled in Medicare during the GEP, your Medicare would not start until July of that year. Beginning in 2023, though, when you use the GEP, your Medicare will begin the first of the month after you enroll. For example, if you enrolled on January 1st in past years, you would have had to wait until July 1st for your Medicare to start. With these changes, if you enroll during the GEP in January 2023, your coverage will instead start on February 1st, 2023. Special enrollment periods, also called SEPs, are periods of time outside normal enrollment periods when you can enroll in Medicare or change your coverage. SEPs are sometimes triggered by specific life circumstances. Beginning in 2023, new SEPs have been created for people who lose Medicaid, are in an area with a disaster or emergency, are released from incarceration, make an enrollment mistake based on misinformation from their employer, or experience other exceptional circumstances. These SEPs create more enrollment opportunities, reduce gaps in coverage, and prevent late enrollment penalties. If you missed an enrollment period and think you may qualify for one of these special enrollment periods, contact your New Mexico SHIP at 1-800-432-2080 to learn more. Last but not least, beware of new Medicare card schemes. New Medicare cards were sent to people with Medicare in 2018. These new cards removed Social Security numbers to better protect people with Medicare. While the rollout of new Medicare cards ended a few years ago, scams about Medicare cards continue. You will not be getting an updated Medicare card this year, but scammers may try to convince you otherwise. For example, scammers may falsely tell you that Medicare is again issuing new cards, perhaps plastic ones, metal ones, chipped cards, or even a black and white COVID-19 card. The scammers may tell you that in order for them to send you your new Medicare card, you need to verify your identity, which could include your Medicare number. This is an attempt to gain your personal or financial information. Beware of unsolicited calls, such as anyone claiming to be from Medicare or anyone who needs to verify your identity or Medicare number so they can send you an updated or new Medicare card. Report any suspected Medicare card scams to your local Medicare Senior Medicare Patrol, or SMP, at 1-800-432-2080. You can also sign up for scam alerts and updates on the Aging and Long-Term Services Department website at www.nmaging.state.nm.us. Your New Mexico SHIP and SMP programs are here to help you with these and any other questions you have about Medicare. Please don't hesitate to give us a call at 1-800-432-2080. We're happy to help.